Assalamu alaikum. I'm Dr. Ejaz Mohiuddin. Today we are going to discuss perinephric abscess. What is perinephric abscess? How does it occur? What are its symptoms? And what are the investigations we are going to do? And what is the treatment we would take? So first slide. Definition: it is the collection of pus around the kidney, in and around the kidney. The kidneys are situated in the lumbar region, and if there is pus around the kidney, the patient then complains there. And how does that infection occurs? How does that abscess forms around the kidney? That is, in case of pyelonephrosis, that is the abscess within the pelvis of the kidney and the nephrons of the kidney. If that is untreated, that leak that crosses the kidney border, and then it collects around the kidney and develops into a full-fledged abscess. Or it may be the patient may have a trauma, and he may have an hematoma over there, which would get an infectious material, and that an abscess is formed over there. Or if the patient is diabetic, he may get renal carbuncle, and from that an abscess is extended over there. Or if there may be a chronic infection in the patient with vertebral tuberculosis, and in those cases that tuberculosis material may come around the kidney and form an abscess over there. Or there may be another way hematogenesis spread, that is, the infection may come from far distant areas such as the appendix or tonsils or any other place, and they may come over there and grow over there. That is, develop into an abscess. So this is how the perinephric abscess is formed. Clinical features. Clinical features are: the patient complains of fever with rigors. He has pain in the lumbar region and fullness in the lumbar region. Patient says there is dull ache, and it is continuously pain, and he cannot stand on it, and he bends on that side. There is fullness. When if we examine, we find that there is fullness. The local temperature of the skin is high, and the patient says it is tender. He does not allow to examine properly. Next is investigation. We would do the CBC count. CBC count, we would find low hemoglobin level because of the infection, the high WBC count. If it is acute infection, neutrophils would be high. In chronic cases, there would be lymphocytes would be high. If we do the urine DR, we see that there is no pus cells or the bacteria. The reason being the abscess is outside the kidney, not within the kidney. Then we examine the CT scan or the MRI or the ultrasound. We find that we see the abscess in around the kidneys. What is its size, how deep it is, and if it is involving any other organ or system. Treatment: open drainage. Treatment of any abscess in the body is drain the abscess, clear the area. So for that we have to do make a lumbar incision over there. Pockets of the abscess are opened, and pus taken for culture and sensitivity, sent for it. Wound is cleaned, washed, dry, and then it is closed with a drain there. A drain tube is put in there. IV antibiotics, analgesics, and anti-inflammatory drugs are given. Post-operatively, antiseptic dressing is done, and the patient settles down in a week's time. I hope you this short presentation would make you understand this perinephric abscess. If you have still any question, you can ask me on the WhatsApp group. Next is the reference. For reference, you have Bailey and Love, short textbook of surgery by Bailey and Love, 26th edition. Thank you.